Dear students, today we are going to study about antiprogestins. In this session, we will study about antiprogestin, their uses and adverse effects. Now, let us start with the antiprogestins. The commonly used antiprogestins are number first, mifepristone. Number second, onapristone. And number third, lilopristone. These are the common antiprogestins used. So let us study about the mifepristone in detail. Mifepristone is a synthetic preparation which antagonizes the progestin effects. As the word indicates, it is antiprogestin, means it will block the actions of the progesterone. Now studying about the mechanism of action. It performs its action by blocking the progesterone receptors. It blocks progesterone receptors and avoids the progesterone to perform its function. Since progesterone is the pregnancy favoring hormone, so it blocks those actions which will favor pregnancy. When those actions will be blocked, it causes number first, decidual breakdown. Decidual breakdown means the changes which are favorable for the developing fetus, the changes which occur in the uterus for the growth of the fetus, those changes gets broken down. It causes decidual breakdown. It detaches the fertilized egg. Means the blastocyst which remains attached to the uterus wall, that gets detached due to the mifepristone. And there is also decrease in the levels of progesterones. When there is a decrease in the level of progesterones, there is an increased prostaglandin level. Especially of PGE2. This PGE2, increase in PGE2 causes uterine contractions. When there are increased uterine contractions, this increased uterine contractions facilitates the expulsion of fetus. It facilitates the expulsion of fetus, which leads to the abortion. So, mifepristone facilitates abortion. By how? It causes breakdown of decidual changes, decreases progesterone levels, increases prostaglandin levels, due to which there is an increase in the uterine contractility, which causes the expulsion of the fetus and leads to the abortion. So it works against the progesterone, hence it is under the antiprogesterones. Now, next its effect is on cervix. It softens the cervix. It was that first action was on uterus. Now it softens the cervix. Softening of cervix also facilitates the expulsion of the blastocyst. If this mifepristone is given in follicular phase, if this mifepristone is given in follicular phase, it stops ovulation. Follicular phase, it prevents ovulation. It prevents ovulation. This mifepristone also has an anti-glucocorticoid activity. Anticorticoid activity. By anticorticoid activity, we mean that it blocks the glucocorticoid receptors. It blocks glucocorticoid receptors. It blocks glucocorticoid receptors. Glucocorticoids are those hormones which are secreted by the middle layer of adrenal cortex. Middle layer of adrenal cortex. Glucocorticoid hormones are secreted by middle layer of adrenal cortex, and this mifepristone works also against these. That is, it shows anticorticoid activity. It blocks the actions of glucocorticoid hormones by binding to those receptors. This was the action of the mifepristone. Now we will study about the uses of mifepristone. Its uses. It is used in the termination of pregnancy. It is used in the termination of pregnancy. When there is a need for termination of the pregnancy, for example, in cases when there are birth defects in the child, in the developing fetus, under the legal laws, we need to terminate such type of pregnancy. In that case, we can give this mifepristone to terminate the pregnancy. It can be given up to the 9 weeks pregnancy. 9 weeks pregnancy. 9 weeks pregnancy can be terminated by giving 600 milligrams of mifepristone. Followed by 48 hours later by prostaglandins, which increases the uterine contractility and facilitates the expulsion of the blastocyst. So this was the use of mifepristone. Next, it can act as an oral contraceptives. It can be given within 72 hours and can be given in the late hours also, like as in case of monthly contraceptions. Next, its use is in uterine fibroids. Uterine fibroids can be reduced in their size by their minimal doses. In that cases, we need to take this drug for about 3 months. Uterine fibroids can be reduced in size by taking mifepristone for about 3 months in a dose of 25 to 30 milligrams daily. That means this mifepristone is also used in reducing the size of uterine fibroids for about by taking this drug for about 3 months in a dose of 25 to 30 milligrams daily. Next, it can be also used in ectopic pregnancy. Ectopic pregnancy. Ectopic pregnancy is that when the pregnancy takes place outside, when the fertilization takes place, the fertilized egg gets implanted outside the uterus. So in that case, ectopic pregnancy, this mifepristone needs to be given. Next, it can be given in the cervical ripening. Cervical ripening. Cervical ripening means preparing the cervix for the labor. In case of normal delivery or in case of this, it can be given by an orally 1 day prior to the labor so as to facilitating the cervix and softening the cervix for the labor. This was about the uses of the antiprogesterone, that is mifepristone. For further details, we will continue in next session. Thank you.